Welcome back, everyone. You know, we're very lucky to have some very important services here in our area. And here to talk about that is Tammie Colon. She's the Executive Director of Mental Health and Recovery Services Board. So welcome, Tammie.
Thank you.
All right, so tell us about all these services that are offered in our area, because there's quite a few.
There are quite a few. You know, every county in the state of Ohio has a Mental Health and Recovery Services Board, or an ADAMIS board as they're sometimes referred to, that has a statutory responsibility to evaluate the needs of the community and develop programming that will attend to those. So we've been very fortunate in our 3 counties. We have great involvement from our community members, and probably our most known services that we offer are crisis services. You know, and that is a service that we need particularly for our 2 rural communities. The ability to have a location 24/7, our hotline. We have people that are responding with our law enforcement officers going out to people's homes to try to engage them and support them. We have a tremendous amount of school-based efforts, both for prevention and early intervention, so that we can help those kiddos and their families. And, you know, we are coming out of the opioid pandemic ourselves, right? And we've done that through partnerships within our communities everywhere in an effort to try to get to folks early, try to prevent deaths, and try to get folks into treatment and recovery.
Yeah, and you think about the importance of mental health these days. You know, like we talk about it all the time. You know, people are struggling, you know, in so many different ways, through, you know, and through so many different causes. And services like you have are just there to help and provide that service that they need, desperately need.
Yeah, I think the community may not understand sometimes that there is a statutory organization who, by the Ohio Revised Code, is required to assess their community, speak with their community members, identify the challenges that communities are making, and address those programmatically and through contracting with providers. And we're grateful that we have the relationships we have, and we just want to make sure that everyone knows we're here for them. You know, we're governed by an 18-member board that's appointed by state and local officials that are made up of family members and people that are highly involved and want to help.
Yeah.
So, and you can go to our website, find out more about what we do and the importance that the people play in supporting the levies that they have supported over all of these years.
So that's the one thing I was going to ask you, is that the money that is needed to provide these important services, where does that come from?
Yeah. So about 48% of our budget is from our local people, from our local levies and the tax support that they have supported us through passing of our levy clear back to the 80s. And then we get federal funds and we get state funds. Our community was recently blessed to be one of 9 in the entire country to receive a very large federal grant that the board went after, so that we can develop some programming to address a certain need that we've identified.
That's amazing. So those levies are important.
They're very important. They are the most flexible funds we have. Those are the funds that we can really develop those niche services, even to serve just a small group of people that our community has identified as a priority.
Yeah, so some of the stuff that you guys, there's so many things that you guys offer, that's the thing. And so understandable where that money is needed, the housing, criminal justice, crisis centers, like, you know, school programs. Those are, you know, you start young and get people, I know those young kids that need a lot of help.
Yeah, we have a lot of facilities that we make available for people to come in anytime of the day, just drop in, to be around folks who are suffering and managing the same symptoms that they are. So, because sometimes they feel excluded from the general population. So we want to give them an environment where they feel safe to be who they are.
Yeah, well, Tammie, keep up the good work. I mean,
thank you.
Your services are desperately needed, and we appreciate it. So thank you.
I appreciate it.
All right, well, don't go away, because medical news is coming up next.